Welcome back to the channel. If you're joining us for the first time, I'm Dr. Michael Morse, a licensed naturopathic doctor serving patients throughout Arizona. In our last video, we began to uncover the complex world of estrogen, particularly the role of estradiol and estriol in managing symptoms of perimenopause. Before we dive deeper, a quick but important medical disclaimer. The information in this video is for educational purposes only and is not to be intended for a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard in this video. Today, we're shifting our focus to another incredibly vital hormone for women, progesterone. This hormone is often referred to as the calming hormone, and you'll soon understand why. However, it's also one of the most misunderstood, largely due to historical confusion between its natural form and synthetic compounds commonly used in conventional treatments. Many women come to me in perimenopause reporting increased anxiety, difficulty sleeping, or even new feelings of irritability and discontent. Often, progesterone is playing a central role in these symptoms, or its lack of balance with estrogen as the culprit. This is perhaps the most crucial point to clarify about progesterone. Not all progestogens are created equal. There is a significant difference between natural bioidentical progesterone and synthetic progestins like medroxyprogesterone acetate, often known as MPA. Natural progesterone, while synthesized from plant-derived steroids, is biologically identical to the progesterone your body naturally produces. It has the exact same molecular structure, meaning your cells recognize and utilize it in the same way they would your own self-made progesterone. In contrast, synthetic progestins are pharmaceutical compounds designed to mimic some of progesterone's effects, but they have a different chemical structure. Because they are not identical to your natural hormones, they can interact with your body's receptors differently, leading to a wider range of side effects and, in some cases, desirable outcomes. The historical confusion from major studies often stemmed from using these synthetic progestins and not natural progesterone. This is a key distinction when discussing risk versus benefits profile of progesterone therapy, and it's a conversation you should have with your doctor. So, why is natural progesterone so important, especially during perimenopause? Its benefits extend far beyond just balancing estrogen in the uterus, ovaries, and breast tissue. There are several areas where progesterone has its focus. Mood and sleep enhancement. Progesterone has a direct calming effect on the brain. It can significantly improve sleep quality, reduce anxiety, and help stabilize mood swings that are so common during perimenopause. Many women describe feeling a sense of peace when their progesterone levels are optimized. Next, uterine health. It plays a crucial role in balancing estrogen's effects on the uterine lining. Estradiol in reproductive years encourages growth. Progesterone, along with estriol, helps ensure this growth does not occur the same way in menopause as it does in your reproductive years. This helps prevent excessive endometrial thickening and reduces the risk of irregular bleeding or spotting often experienced in perimenopause. Next is bone density support. Like estrogen, progesterone is vital for maintaining healthy bone density. It helps stimulate bone-building cells called osteoblasts, offering another layer of protection against osteoporosis. It can also help with breast health. Natural progesterone is generally considered to have protective effects on breast tissue, counteracting some of the most proliferative or growth-promoting signals from estrogen, contributing to overall breast health. It can also help with lung and immune support. Interestingly, progesterone receptors are abundant in the lungs. Research has highlighted its role in lung repair after illness and supporting immune function, demonstrating its broader systemic impact beyond reproductive health. And lastly, it can help with gut healing. Progesterone helps strengthen the integrity of your gut lining by increasing the expression of occludin, a protein used in the tight junctions between intestinal cells, which decreases gut permeability. A healthy gut is foundational to overall health, immune function, and nutrient absorption. During your reproductive years, progesterone levels naturally rise significantly after ovulation, in the second half of your menstrual cycle. This rise is what signals your body to prepare for a potential pregnancy, but it also provides those calming and balancing benefits. In fact, its sudden drop-off just before menstruation is typically what triggers the symptoms of PMS. However, in perimenopause, as ovulation becomes more infrequent and erratic, progesterone levels are often the first hormones to fluctuate wildly and then decline. This can happen even before you notice significant drops in estrogen, and because progesterone, particularly through its metabolite allopregnanolone, modulates GABA receptors as well as influencing levels of serotonin and dopamine, you can see why fluctuating levels of progesterone can wreak havoc on mood stability. This earlier and more dramatic shift in progesterone is a key reason why many perimenopausal women experience frustrating symptoms like insomnia, anxiety, and heavier periods long before they start having hot flashes. Optimizing your progesterone levels can be one of the most effective first steps in restoring balance and alleviating many of these early perimenopausal symptoms. Understanding natural progesterone's distinct role and its profound benefits is truly empowering. It's a key piece of the hormonal puzzle that can bring significant relief during perimenopause. In our next video, we'll tackle another incredibly important hormone for women that's often overlooked or misunderstood: testosterone. We'll explore why it's vital for your energy, libido, muscle health, and more. If you found this information valuable, please give this video a thumbs up, subscribe to the channel so you don't miss our upcoming videos, and share it with someone who needs to hear this message. Remember, feeling your best is within reach. I am Dr. Morse, a licensed naturopathic doctor serving patients throughout Arizona, and I'm here to help educate you on your health journey.